Mabuhay! Good morning, Philippines! Lalong-lalo na sa ating mga kababayan dito sa Eastern Visayas. To our viewers and listeners po sa Biliran, Leyte, Southern Leyte, Eastern Samar, and Northern Samar, maupay nga adlaw, maayong buntag sa inyong tanan. Maraming salamat po sa lahat ng tumututok sa ating mga episodes dito sa Dayon DOH. Kasama niyo po kami sa pagpapalawak ng kaalaman ukol sa mga serbisyong hinahatid po ng aming ahensya, ang Department of Health Eastern Visayas, Center for Health Development, ang ating DOH Treatment and Rehabilitation Center sa Dulag, at ang DOH retained hospitals natin dito sa Eastern Visayas, ang Eastern Visayas Medical Center at ang Governor Benjamin T. Romualdez General Hospital and Schistosomiasis Center. We are live po sa PRTV12, Favorite Music Radio 100.7 at sa official Facebook pages ng DOH Eastern Visayas Center for Health Development at ng PRTV12. In our previous episodes featuring Eastern Visayas Medical Center, nakasama natin si Family Planning Unit Head Dr. January Dukdukan at ang Social Welfare Officer 1 ng Women and Children Protection Unit na si Miss Leoma Godinez. Napag-usapan natin at naibigay natin sa ating publiko ang mga serbisyo at mga impormasyon na kailangan nilang malaman ukol sa dalawang units na ito ng Eastern Visayas Medical Center. So mga hindi po nakapanood ng ating mga previous episodes, please visit our official Facebook page ng Department of Health Eastern Visayas at look for or search for the Dayon Kita DOH videos. Alright, so this morning, balik Eastern Visayas Medical Center po tayo. And this morning, we will be featuring another two specialty units or specialty centers ng Eastern Visayas Medical Center. Ang Mental Health Center o ang Psychiatry Department and the Philippine Institute of Traditional and Alternative Healthcare Unit. Sisimulan natin ang ating umaga sa pakikipag-usap at pakikipagtalakayan tungkol sa Mental Health Center at ang Psychiatric Department ng Eastern Visayas Medical Center. Kasama natin this morning and we are so glad to have him with us, ang Medical Health Center Head and Psychiatry Department Chair, Dr. Benjamin Rodrigo Serogo. Hi Doc, good morning.
Good morning, Ma'am Jeline, and good morning to all the listeners and watchers of this station, Eastern Visayas and all the neighboring regions of Region 8.
Alright, thank you so much. Unang-una sa lahat, Doc, we would like to thank you for sparing us your time. We know how busy yung inyong department or yung center ninyo po sa Eastern Visayas, and you coming here to PRTV12 and sharing us with your time. Maraming salamat po kasi it would mean na marami sa ating mga kababayan dito sa Eastern Visayas ang makakatanggap na naman ng panibago at karagdagang impormasyon tungkol sa mga serbisyo na inihahatid po ng inyong hospital ang Eastern Visayas Medical Center. So thank you so much, Doc. Alright, so Doc, simulan na natin. Paano or bakit po in-establish yung ating medical center or yung psychiatry department or yung unit po ninyo sa Eastern Visayas Medical Center?
Sa una sa lahat, gusto ko lang mapaaralan yung lahat at masabi ito na ang health or pangkatawan, kalusugan, ito ay nagsasabi, our own understanding, that ito lang ay tungkol sa physical or sa katawan natin. But gusto ko ipaalam sa lahat na hindi lamang ang isang tao ay tungkol sa katawan at lahat ng mga sakit na tungkol sa katawan. Ito rin ay tungkol sa pag-iisip. So, mas na-pronounce ito ngayon sa COVID pandemic. Marami ang nagkaroon ng mga problema sa pag-iisip. Kasi yung problema sa pag-iisip ay hindi lamang yung tinatawag natin sa ating local na dialect na nalulurong or sa Bisaya na buang. Okay? All the others, especially anxiety and depression, nga walang katumbas na pananalita, di ba? When we say anxiety, hindi natin alam ano yan, di ba? When we say depression, parang borrowed, this anxiety, depression, they are borrowed words. Okay? So, going back to your questions, psychiatry service in Region 8, in EBMC particularly, has been present since 1975. Okay? There was an outpatient department, there was a ward before. However, during the middle of 1980s, the ward was dissolved. So EBMC, yung service lang na binibigay ay sa outpatient department. So dahil sa bagyong Yolanda na marami ang tumulong sa atin, international NGOs and all the other local government offices, napansin nila na wala tayong mental health wards. Okay, nagtatanong sila, yung Tacloban City, meron ba? Wala. Yung province of Leyte, meron ba? Wala. And all the other provinces in Region 8. So dahil doon, nagawa ito na maglagay tayo o magbukas ulit yung mental health ward. So aside from the outpatient services, binuksan natin yung mental health ward, ang tawag natin acute crisis intervention service na ward. It's a 10-bed ward with 1 psychiatric emergency bed to cater to our people. Pero, alam mo, yung population ng Region 8 is 4 million. And for mental health, we only have 10 beds at present. Okay? At EBMC Magsaysay, where the psychiatry department is located and the ward is located, we only have 10 beds for admission. Kaya nabugso ito na ilagay ang psychiatry or mental health center. Ang purpose talaga nito, number 1, to provide mental health service to the people of Region 8. Okay? If we will go by the primary health care, it should be that mental health care service should be accessible, should be acceptable, should be available, and should be affordable. That's number 1. Number 2, ang Region 8 ay parating meron natural disaster. Mga bagyo, iba-iba. Mga floods. Marami tayo every year. So we also give psychosocial services, interventions. Okay? And the last, and we are proud na malaman ito ng lahat. Kasi hindi lang sa pasyente ito at sa mga pamilya ang service ng psychiatry department and the mental health center. It also includes for all the doctors and the nurses. That today, meron na tayong accredited residency training program. Kung saan itong residency training program ay makaproduce tayo dito ng highly skilled workers, mental health workers, okay, that can give quality care to all the people of Region 8. So yun ang kaya nabugso ang psychiatry.
So, Doc, paano naman po yung main function or yung pangunahing tungkulin po o mga serbisyo na hinahatid po natin sa ating mga clients?
So, yung pangunahing tungkulin, of course, is to provide assessment, diagnosis, treatment to people who need mental health care service. Pero katulong dito yung mental health promotions and mental health wellness, which is the preventive aspect. Para malaman ng tao paano mag-deal nito. So, doon sa COVID pandemic, there were some radio stations who availed of these services. Okay, there were other employees who availed of the service of mental health. So, the main functions of the department or the center, mental health centers, at present, we have an outpatient service. Itong outpatient service ito is available every day except Wednesday. Okay, for old patients. So, ang outpatient ay ang mga follow-up cases. Okay? From 8 in the morning hanggang 5 in the afternoon. Pero kung bago ka, pwede ka matingnan. Okay? Every day. Okay? But you will be at the ward. You will be seen at the ward. But anyway, kung outpatient ka, gusto mong service na outpatient, matitingnan ka. Okay? We also have our Psychiatry Emergency Crisis Center. So, sino ito? Yung mga pasyente na violente, suicidal, at kailangan ng tulong ng mental health, pero hindi pa decided na i-admit. They will be placed at the PEC, ang tawag namin PEC, Psychiatry Emergency, for a maximum of 24 hours. After that, the family should decide whether to be admitted or not into the ward. The next would be the ward admissions, yung 10-bed natin. For the 10-bed ward, meron kaming mga dapat sundin. Mayroon tayong dapat sundin, okay? So, ang isa nito is you should be at the ward for 14 days. Ito talaga ang minimum and maximum period that you will have to stay in the ward. Hindi pwede na magpapa-admit ka lang ng isang araw or 2 araw para lang hotel. Hindi pwede. Sa tingin namin is because the medicine will work after 10 to 14 days pa. Hindi ito yung pangkaraniwan na pangsipon at panglaglat lang. Okay? Number 2, there should be 2 watchers. Hindi pwede na walang watcher. Pwede kami magpalagay ng isang watcher, pero yung watcher na yan, hindi lalabas sa ward. Maraming tatanong nito, Dr. Go, or my residents, okay? Bakit hindi na lang namin iwan yung pasyente? Of course, we don't like that. We want the family to be involved for the treatment of your patients, okay? Maraming pamilya gusto na lang iwanan ang ganitong mga pasyente. Kasi para sa kanila, wala nang pag-asa. Okay, hindi nila alam na meron tayong mental health service, meron tayong mental health treatment. Other services would be the forensic psychiatry or the medical legal cases. So, meron din tayong mga pasyente na nakukulong o na gumagawa ng marahas dahil sa sakit nila. So, for this, tinitingnan sila every Wednesday from 9 a.m. to 12 a.m. Pero dapat meron court order. At saka meron pang ibang mga requirements. Social case study. At saka yung isa is there should be an informant, family or relative. Because sometimes if the patient meron pang sakit, hindi siya makapagsalita ng maayos. So there should be somebody. Okay, so the next would be the consultation liaison. Okay, or the referrals. Referrals come in two. Okay, there are referrals within the hospital. There are also referrals coming from other centers or agencies. Okay, from other hospitals or from other local health units or even from Good Samaritans. And the last would be, no, there are still two. Other one would be your psychological services being provided now. If you will notice, na halos lahat ng empleyado, maging gobyerno o maging private man, hinihingan na ngayon ng neuropsychological or neuropsychiatric test. Paano ito nangyari? Dahil nalaman na natin na hindi lang katawan yung health, pati pag-iisip. Okay? Pag-iisip mo ay, siyempre, nagkasakit, hindi ka talaga makapagtrabaho sa isang opisina. Much more than that, yung relasyon mo sa co-workers at saka supervisors mo hindi maganda. So we have that psychological service. However, by appointment only. The last would be research. Being an APEX center and being a training hospital, training department, researches are there, okay? Researches are there.
So, with that comprehensive po ng mga serbisyong hinahatid po ng ating unit or yung ating center, ano po yung mga or paano po natin maa-avail ang mga services na ito? Paano po yung ating mga nakikinig at nanonood ngayon makaka-avail ng mga serbisyong na-mention niyo po, Doc?
Sa lahat ng gusto mag-avail ng mental health service dito sa EBMC, Magsaysay, we are located at Magsaysay at the present, you just may go in as walk-in. Number 1. Number 2, you can have a referral from other doctors or from other departments or from other agencies. Yun ang isa. Pag pumunta ka ng outpatient department, you will buy a card. Yun ang may bayad. 50 pesos for the card and for the chart. Okay, so for the ward, for the admission, it's upon the discretion of the resident. There is no, I believe in the ward because we are practicing still COVID precaution. You must have the vaccination card. Otherwise, if you don't have a vaccination card, you'll be placed at the PEC. Tapos, isaswab ka. Pati yung significant other, which hindi libre. Ang libre lang patient. Okay? Or you may contact us with the following numbers. At Psych OPD, it is 0905-885-0766. Or at the Psychiatry Ward, it is 0927-323-3556. Email is available and it is at psych.ebrmc@gmail.com for any of your inquiries.
So, Doc, na-mention niyo po kanina, you accept walk-in and referral cases. And as the Apex Hospital po dito sa Eastern Visayas, ano yung role ninyo sa buong region when in terms of mental health or psychiatric clients?
So, we will talk about the Apex Center. Okay? Apex Center, ang ibig sabihin lang nito, Ma'am Jeline, is ikaw yung end referral center ng Region 8. Okay, so lahat ng mga kaso na hindi na ma-manage sa local level, pwede mong ipadala sa Apex Center. Pero ang nag-facilitate nito ay yung mga local health centers, local government units, and all the other private hospitals. Okay, they give out a referral form for the patient to be referred. They may also call the department in advance that they have a patient, especially those for admissions. Yun ang tawag na Apex Center. So ang Apex is like a triangle, not triangle. The base is the community, and the community comes from the different barangay. Upper, it will be your LGU, di ba? So, your rural health unit. From the barangay to the rural health unit, and then you bring them to the district hospital, and then if the district hospital refer to the mental health center here in EBMC. Sometimes this is being abused. Okay? Because from the barangay level, you go straight to, it should not be, okay? For the mental health service here in Region 8, and for the mental health program here in Region 8, this protocol should be followed, di ba? Para maintindihan ng lahat, okay? That is how we work, okay? From the local. So, sa lahat ng mga taga-Region 8, halos lahat na ng LGU or rural health units, na-train na sila ng mental health track. Meaning to say, yan ang mga basic na pag-identify, pag-diagnose, at pag-manage ng mga sakit ng mental health. Okay, so it's there. Okay, that's how it goes, okay? And referral, sa lahat ng mental health cases for the region.
So, napakahalaga ng mga nasabi po ni Doc Go, kasi for us to help also the center, yung mental health center ng Eastern Visayas Medical Center, we need to decongest them. So kailangan, since equipped na yung ating mga local government units, yung ating mga rural health units ng MHGAP and other mental health interventions na I believe binibigay na ng Department of Health katuwang ang ating Eastern Visayas Medical Center. I believe we need to capacitate and apply this training sa inyong level para hindi naman masyadong magamit or ma-abuse as Doc Go mentioned yung mga services po ng higher centers, especially na mas baka ma-deprive yung mga mas nangangailangan ng serbisyo na kaya or dapat sana ibinibigay ng Eastern Visayas Medical Center. Tama po ba, Doc?
Yes, Ma'am Jeline. And to add to that, okay, meron na tayong isang graduate ng training program, pero nandyan siya sa EVMC. Meron pa tayong 4 na graduating. Okay?
Sa ating residency.
Sa ating residency. Accredited Residency Training Program. At meron pang 3. So, naghahanap pa kami ng iba. Bakit importante ito? Because these doctors who will graduate, pwede ito ma-disperse sa region.
Yes.
And they can help as much. We can help more patients needing the mental health service.
Yeah, mas dadami pa ang ating workforce when it comes to the provision of mental health services, no? Okay, so siguro we should also invite other doctors na mag-enroll po ng mga residency programs, no? You could enroll sa ating residency program ng mental health. Tama po ba?
Thank you very much, Ma'am Judith.
Yes,
So I would like to take this opportunity, okay, as an advertisement to all those medical doctors who have just graduated, or even those who have not graduated, who wants to specialize in the field of psychiatry or mental health, that EVMC Department of Psychiatry is accepting residents for training. Thank you for that, Ma'am.
Yes po, kasi we know how important po yung mga mental health services nowadays, diba, Doc? So, kailangan talaga natin ng more healthcare workers providing such services. Okay, so Doc, babalik po tayo sa ating mga mental health services. Baka kailangan ma-inform natin ng public, baka may mga apprehensions po sila sa pag-avail ng ating services. Magkano po yung mga serbisyo? Kung mag-avail po sila ng mga services ninyo, magkano po yung dapat nilang i-prepare para naman sa kaalaman po ng ating publiko?
Sa EVMC, we will just divide it, okay? I-divide natin. For outpatient service, I mentioned earlier na 50 pesos lang ang card. Okay? And the consultation is free. Pero yung gamot, yun ang babayaran. Okay? If there are medicines being given out. Kung meron tayong program ng DOH, yung Medicine Access Program, so yan ay libre. So kung meron mga gamot na galing sa MAP, galing sa DOH, ito ay libre. However, kung mawala na yan, then it will not be free anymore. They have to buy it. That's number 1. Number 2, for those admitted. So, ang admitted patients, kung PhilHealth Fund member ka, it is zero balance billing. So, wala talagang babayaran. However, if you are not a PhilHealth member, then meron ka lang babayaran. So, ano pang ibang gastos? Siyempre, yung mga bantay mo, hindi naman yan kasama sa mga pagkain. Okay, so you will be paying for the, for the food of your officers. Parang yun lang.
Okay. So basically, sa mga services po na ibinibigay natin lahat, yung konsulta, yung mga mental health interventions, libre po lahat. Libre. Alright, that's good news po sa ating mga nanunood at mga nakikinig this morning. Alright, so as na-mention niyo po kanina, meron tayong 10-bed capacity sa ward. Ano pa po yung mga amenities or equipment na available sa ating center para sa ating mga clients po?
So, sa mental health, pag-iisip ito eh. Okay, so, although ito ay pag-iisip, meron tayong ibang mga equipment na kailangan. Dapat may laboratorio. Kasi minsan, labot lang napiktuhan ang huna-huna, baka yun ay galing sa physical na sakit. So, titingnan pa rin yung laboratory mo. That's number one, okay? The others would be EEG. So, yung ibang nagkakaroon ng sakit ay galing sa convulsion. Okay? Parang naiiba yung pag-iisip mo, naiiba yung behavior mo. Ito ay dahil sa mga seizure o convulsion. So, meron tayong tinatawag na EEG or electroencephalogram machine para matulungan pag-diagnose. All the others are just the simple equipments like sphygmo, weighing scale, parang ganun lang.
Okay. So, Doc, yung 10 na ward, 10-bed capacity po ng inyong ward, and then you provide other services po. Mga ilan po yung ating census in a day or in a month, yung average po natin na clients na nakikater natin?
For the outpatient service, we cater to about 50 to 70 patients araw-araw. Okay, for an average of like 300 in a week or 1,000 plus in a month.
Ang dami naman, Doc. Ang dami, Doc.
I feel it is not done.
Okay. Pero do we have enough workforce sa inyong center? Do we have enough psychiatrists, psychologists, nurses to provide and cater to this number?
It's never enough. Okay, we will just go by the numbers. Okay, let's say depression. 50 incidence is 15% of the population. How many is 15% of 4 million?
Yes.
So 500.
Mga 500,000.
500,000. Okay. So for alone, for depression alone, okay, it's 500,000. 10% mga silong ta. So what is our census? It's only 50 to 70. Where are the rest? Let's just say that for the 500, only 10% of those would like to seek treatment. It is 50,000. Where are those patients? Because we only have 50 or 70 a day.
Kaya pala you said na hindi siya ganun karami as you would expect.
We would like this. That's only one, okay?
Okay.
There are 300 different mental illness aside from depression. Okay, for schizophrenia, itong sakit na pinakamalala na one of the schizophrenia type is yung taong grasa. Diba? It is 1% of the population. So, 4 million, ilan ang 1%? Let's say 40,000. Where are they? Konti lang naman ang nakikita natin sa daan, di ba? And where is, di ba? 40,000 against, let's say, 1,000 a month. It's still very low.
How about sa partners po? Do we have partners with other development partners, mga NGOs or other partner agencies that provides or serves as additional workforce or additional resources, for example, supplies, kahit ganyan, may mga support na nakukuha ba ang EBMC?
So this is one of the area wherein we need to improve. Okay? So when we say workforce, being a training hospital, I don't like to call them workforce because they are studying, di ba? But they can help example, these medical clerks. Medical clerks are fourth-year medical students. So they rotate in our department for 2 weeks, so they can be an additional workforce. Some psychologists go to our department for their masteral. So they need hours, certain number of hours for them to complete to become a master. So we already have that. Some of the nursing students, okay, not all, others would still like to go to Cebu, would like to go to Manila. However, I would like to tell these nursing schools that our psychiatry department is now an accredited residency training program and they can provide these services.
So, pwede na sa mga nursing
You don't have to go to
students.
Cebu. Okay? To Cebu, okay. To San Vicente. That was before, okay? And it's a break. Even if you will study psychiatry, you don't study psychiatry. You go to the malls or whatever in Cebu. Okay? For the NGO partner, this is what we are looking for. The linkage. It is always there, available for us. There have been some agencies before who has worked for us, especially after Yolanda. However, at present, for a continuing NGO, whether it's international or whether it's local, here in EBM, here in our region, we have yet to look for these partners. And it is one of the things that is a challenge to us. Okay?
And speaking of challenges, do we have any other challenges, Doc? Especially, for example, you only have 10 beds and to cater mga inpatients. Do you take that as a challenge so that mas marami pa yung ating mga clients na pwedeng ma-admit?
The first challenge, and it's a problem not only here in the region, is to break the stigma of mental health illness. Okay? Tayong mga Pilipino, mauwaw or naawod. Anong Tagalog ito? Nahihiya tayo na meron tayong mental health problem. Pero ito lang masasabi ko. Walang ni isang tao na walang problema. Okay? It may not be na malala tulad ng taong grasa, but we all have our own mental health problem. Okay? So, breaking this stigma, nakakahiya. Bakit tayo nahihiya? It is because of our culture. Anong culture natin? Yung mga ninuno natin, gusto, ang nalalaman lang nila at gusto nila na yung sakit ay katawan lang. Di ba? Pag ikaw, meron kang ibang behavior ngayon, anong sasabihin? Napas mo ka, hindi ka kumain. Naairi ka. Gibarang ka. Gisaniban ka. They are all more of physical. Nakalimutan na kasama sa katawan natin yung pag-iisip. So, that's the first and primary challenge that we have to break through. To be able to accept the mental health problems. Kasi kung ma-accept natin ito, pupunta na tayo ng ask tayo, hihingi tayo ng tulong sa mental health problems. Okay, that's first challenge. The second challenge, you are saying about the facility. Right now, the mental health center is in progress in Bagakay. We are trying to open up a 36 or a 38 bed facility. Although it is just for adult psychiatry. Alam mo, yung psychiatry ngayon, dahil sa progress ba yan ng mundo, we try to specialize everything, okay? So, sa una, isa lang, okay? Sakit sa pag-iisip. Tapos. Pero ngayon, dapat maiba. Iba na yung bata, iba na yung katulad natin na adult, iba na yung mga matatanda, geriatric. Okay? Meron pang iba. Iba na yung mga addict, iba na yung mga may neurological problem, yung mga seizure, iba na yung may forensic problem, iniba-iba ito. So, but our mental health center is improving and able to cater 38 beds for adult psychiatry. And of course, there it's an improvement, but it's still a challenge. It's still in the works. Hindi pa natatapos. Others would be the budget. As Filipinos and our government, budget is not enough. We know that, okay? I hope they can improve the budget and make mental health a priority again by the government.
And speaking of that, Doc, matanong ko lang, yung 10-bed capacity natin na ward, are we catering both for male and female or male? Male and
Yes,
female.
Ma'am Jeline, we are catering both male and female. However, the ward is divided into 5 female beds and 5 male beds.
And currently, they're all occupied.
Currently, we have 4 vacant beds for today. If you want to avail, you can go there, okay?
Okay. That's good news po for our viewers and listeners listening kasi baka mayroong mga gustong magpa-admit ng kanilang mga family members pero baka nasabihan before na full yung ating ward. Alright, so sige. So with that, thank you so much, Doc. Do we have any more topic to discuss? Baka may gusto pong i-add na gusto mong ma-inform yung ating public about our operations, our functions, ano pa po?
So for my finishing touches, okay, mental health service is available at our center at EVMC. Please don't hesitate to come. Okay? Pero yung sinabi ko, dapat matanggap natin muna na merong ganitong sakit. Pag matanggap natin, then we will be happy to serve you. Yun ang isa. Yung pangalawa, again, I would like to take this opportunity to inform all newly graduated doctors and all those doctors who want to specialize in mental health or psychiatry that we have now an accredited residency training program where you can go into or tap, okay? You don't have to go to Cebu, you don't have to go to Manila for this. Okay, so that we can build mental health here in Region 8.
Thank you so much, Doc Benjamin. Maraming salamat po, Doc Go, for your time at sa mga messages and sa information shared to our public this morning. Maraming salamat sa pagpapaunlak po sa ating programang Dayon Kita DOH. Another specialty center or specialty unit or department unlocked sa Eastern Visayas Medical Center. Marami tayong natlaman at natutunan sa ating discussion this morning with Dr. Go here. Maraming salamat. So I am sure na marami sa ating mga manonood sa Eastern Visayas ang nakatanggap ng marami or karagdagang information tungkol sa mental health services ng Eastern Visayas Medical Center. I'm sure they will feel more at ease knowing na meron po tayong ganitong mga serbisyo na binibigay ng ating mga DOH retained hospital, particularly ang Eastern Visayas Medical Center. Available, accessible, and affordable po na mga serbisyo. So muli, maraming salamat, Dr. Go, and of course kay Doc Ivardone, Doc Salvador Ivardone, yung ating Medical Center Chief ng Eastern Visayas Medical Center for allowing Dr. Go to come here and share with us this very important information that our public needs to know. Alright, so maraming salamat once again, Doc Go, and sa ating pagbabalik po, matutunghayan naman natin ang isa pa sa mga specialty units ng Eastern Visayas Medical Center, and that is alright, sa ating pagbabalik, matutunghayan naman natin ang isa pa sa mga specialty units ng Eastern Visayas Medical Center, ang Philippine Institute of Traditional and Alternative Healthcare. Kaya tumutok pa rin po tayo, magbabalik po ang Dayon Kita DOH. Nagbabalik tayo sa programang Dayon Kita DOH. Live pa rin po tayo sa PRTV 12, Favorite Music Radio 100.7 at sa ating official Facebook page, ang Department of Health Eastern Visayas. So kanina, napag-usapan natin ang Mental Health Center ng Eastern Visayas Medical Center together with Dr. Benjamin Rodrigo Cerro Go. Ngayon naman, we will be featuring another specialty unit ng Eastern Visayas Medical Center, ang Traditional and Alternative Healthcare Wellness Center. And today, this morning, we are so glad to have with us Traditional and Alternative Healthcare Coordinator, Dr. Randy Saavedra. So, good morning, Doc.
Good morning.
Welcome to Dayon Kita DOH.
Thank you for inviting me.
Alright, so any greetings to our audience po? We have viewers po aton PRTV 12 and listeners through our favorite music radio 100.7. Any message po? Greetings!
Good morning to all the audience, all the staff of EMC. I'm here at PRTV 12 for the Dayon Kita DOH.
Yes.
Thank you for inviting me again.
Alright, so thank you so much, Doc, for sparing with us your time para sa programang ito na Dayon Kita DOH. As I have mentioned to all the other guests po ng ating programa, we are so glad na pinapaunlakan niyo po kami kasi we know how busy you are at Eastern Visayas Medical Center and kumukuha kami ng isang at least 30 minutes of your time for this. Kasi alam namin din, Doc, na marami sa ating mga kababayan dito sa Eastern Visayas ang interesado and siguro hindi rin alam yung ganitong unit or services na binibigay ng Eastern Visayas Medical Center. That is why we want to promote and inform them. This is the perfect venue po. That is why we would like to thank you po for your time. Maraming salamat. Alright, so this will be a very interesting topic this morning. Simulan na natin, Doc. Alright, so Doc, unang-una sa lahat, ano ba ang Traditional and Alternative Healthcare Wellness Center sa Eastern Visayas at Eastern Visayas Medical Center at kailan ito nagsimula?
So, ito po ay isang unit ng hospital na kung saan iba't ibang serbisyo at advokasya na binibigay ng hospital na hindi nakapaloob sa Western medicine. So, ito po ay ginagamit sa prevention, diagnosis, and treatment of mental and physical illness. So, this started about last January 13, 2021.
Okay. So, sino-sino po ang mga pwedeng magpakonsulta sa inyong unit?
Basically, yung patients namin dyan are both old and young, as long as they prefer traditional and alternative healthcare or traditional and complementary medicine. Some of my patients, there are those with having pains, or some other patients, those that needs more holistic care and those needs lifestyle modification, like diabetes, hypertension, and others.
Okay. So, ano po ba yung schedule ng ating mga serbisyo? Or for example, magpapakonsulta po sa inyong unit, anong schedule po ang sinusunod?
Sa ngayon kasi, konti pa lang yung practitioner. So, our schedule is Monday to Friday, except Thursdays, from 8:30 to 12 noon. But if mas marami ng practitioner na magpo-provide ng service, baka ma-expand pa yung aming oras na pag-provide ng services.
Alright, so sinabi niyo po yung practitioner, may we just know kung ilan po yung ating trained na mga healthcare practitioners ng traditional and alternative healthcare?
Before, marami kaming na-train, kaya lang yung iba ay nag-graduate na from residency, yung iba yung nurse lumabas na. So far, ang nandyan ngayon ay we are 3 who are trained, but yung nakatoka talaga dyan sa center is 2.
Ikaw and
Ikaw
then...
at saka yung isang family medicine physician.
I see, okay. So, ano naman po ay yung mga serbisyo na binibigay po ng inyong unit, yung ino-offer po natin sa ating mga clients, aside from the ones that you've mentioned?
So, number 1, ang familiar dyan is yung acupuncture, wherein yung gumagamit tayo ng fine needles and doon sa mga acupuncture points. Ito ay nakakatulong sa pag-promote at pagpapanatili at pagpapaganda ng at pag-iwas ng mga sakit. Another is yung pag-promote ng herbal medicines, yung 10 halamang gamot. At in addition sa una, yung meron din kami moxibustion, yung gumagamit ng heat sa mga acupuncture points. And currently, we have what we call as the functional medicine. Dito, kasi hindi siya familiar pa ng marami, maglaan ako ng mas detalyadong paliwanag. Ito ay medyo bago pa sa Pilipinas, although marami, kakaunti pa lang yung nagtitrain sa whole Philippines. But ito po ay ongoing na sa ibang Eastern countries like Europe and US. Ito ay, ang sabi ni Dr. Hyman, this is the science of holistic healing, kung saan ito ay umusbong at lumalago na diskarte ng pag-aalaga sa pasyente. Ito din ay based sa whole systems approach na kung saan hinahanap namin yung ugat ng sakit o yung root cause, as compared to the conventional, which usually we just treat the symptoms. Tinutugunan din ng functional medicine ang overall well-being ng isang tao, na kung saan ito ay based sa, hindi lang ito base sa mga simptomas nila. Ang functional medicine practitioner ay nagpo-promote ng wellness sa pamagitan ng pag-focus sa kung ano yung sakit na nakaka-influensya sa karanasan ng bawat pasyente. Usually, pinopromote namin is nutrition management, exercise, and movement prescription, sleep recommendation, as well as yung stress management and yung problema kung may mga problema sa relationship. So basically, ang isang advantage din ng functional medicine is in-encourage namin yung collaboration ng different wellness practitioner or providers like functional medicine practitioners, nutritionists, dietitian, minsan nag-ano kami ng health coach, or kung kailangan ng psychologist, na-refer namin sa psychologist. So parang ano siya, collaboration ng different
So, very holistic talaga yung approach ng traditional and alternative healthcare compared to the conventional. So, by the way, Doc, let me ask this question. What made you parang interested or mag-focus sa traditional and alternative healthcare?
Actually, since naging DTTV ako before, I was looking for a job or a specialty that is more holistic, kasi nakita ko the regular treatment ng patient, yung papacheck yung patient, tapos prescribe ko lang ng gamot, tapos short na health education, tapos uwi na. Pero usually ang karamihan ay sinasagot lang natin yung symptoms. Pero sa functional medicine, nagdidig deeper tayo, nagkikipag-usap tayo ng mas matagalan sa patient, and we allot more time so that we know better what's the cause of the disease, and at the same time, it is also healing when you provide more time to the patient. So, minsan nga yung makipag-usap lang yung patient, gumagaling na sila. So, yun kasi yung parang sa akin nagkukulang sa Western medicine. Siguro sa karamihan ng patient, minsan wala na silang time to interact and go deeper to what is really happening to the patient.
So, may bayad po ba? Ito yung gustong malaman siguro ng ating mga manunood at nakikinig this morning. May bayad po ba yung pag-avail ng services natin sa TAC?
Sa ngayon, kasi bago lang siya, at saka inaayos pa namin yung pricing and other packages. So, free pa siya. But if ever meron na kaming packaging and other yung pricing, baka i-announce lang namin. Pero pag mga indigent naman, basta humingi lang ng tulong sa medical social services, makaka-avail sila. para naman hindi sila matakot kasi may bayad.
So, ano naman po yung ating proseso? Anong prosesong pagdadaanan ng ating mga clients kung magpapakonsulta po sila sa inyong unit?
Tulad ng ibang clinics, usually yung patient is pupunta sa triad sa baba. Then, mayroon din naman triad sa FAMED. Doon sa FAMED, i-assign siya sa top wellness center sa 3rd floor. So, for cases of acupuncture, usually kinukunan muna namin ng history at physical exam, and ini-schedule namin for the acupuncture kasi mahirap din isabay-sabay lahat kasi yun nga, limited lang yung practitioner. For functional medicine consult, we allot more time. So, yun nga, dig deeper to the history at saka inire-relate namin yung sakit ng pasyente to what's happening to his environment, to his lifestyle, and also to his or her genetics. Ang mga findings usually dinidiscuss namin with the patient, ni-explain, at saka after that nire-refer namin for diagnostics or laboratory. Tapos, pagbalik din ng patient with the laboratory, yun na, pre-prescribe na namin ng mga gamot kung kailangan ng prescribed medicine, or mostly binibigyan ko sila ng therapeutic diet or nutrition food plan. Tsaka kung kailangan ng mga supplements or mga herbals, pwede rin sila doon. Ang iba rin, pag kailangan ng may mga mental health issues, we refer them for stress management or counseling. Basta basically, ang whole of system approach is focus namin yung lifestyle modification talaga. Hindi lang kami up to the prescription of medicine, we need to really change the lifestyle of the patient.
Ano ba yung...
with the assessment, with the help of the patient also.
So, ibig sabihin, same process, mas magkakaroon lang ng longer na interaction, yung interview to discuss yung mga history, past and medical history. Oo. So, para mas malaman ng mas mabuti yung mga yung status ng health ng isang pasyente.
Tsaka importante rin malaman talaga ng patient ano nangyayari sa kanila. Hindi lang sa sinabi lang, kasi basically ang paggamot ng patient sa functional medicine, malaki ang role ng patient talaga. Hindi lang doktor yung, sabi ko nga, mas marunong sila sa kanilang sakit kaysa yung doktor. Kasi yung doktor is nag-analyze, nag-assist. Pero ang nangyayari talaga sa kanila, mas alam talaga ng patient. So you should dig deeper. Dapat ilabas nila ano talaga nangyayari sa kanila.
And since we're talking about the process flow, mga ilang oras usually yung time frame ng isang patient po?
Usually 30 minutes to 1 hour talaga. Matagal siya.
So matagal talaga.
We more time. So,
compared to the usual consultations. Okay. So kung ako yung mag-undergo or ma-submit ako ng isang consultation under the functional medicine na treatment, what do you call that? Treatment ba do? Parang after siguro ng 1 hour na interview, pag-uusap, feeling ko I would imagine na yung patient would really feel more parang relieved siguro to this, totoo nga kasi yung idea pa lang na mapag-uusapan yung mga dapat mapag-usapan regarding your health, malaking tulong na siya compared kasi yun nga, yung mga consultations natin usually would take malaking time na yung 15 minutes for a single consultation.
In addition, meron din kaming binibigay ng mga basahin flyers. Tapos ano yung sa lifestyle, so sa nutrition, lahat. Meron silang dadalhin na ready.
So, docs, once magpapakonsulta sila, ano naman po yung mga dapat nilang dalhin or requirements na kailangang dalhin during the consultation?
So, pag referred sila from other specialty or other facility, dapat meron silang referral letter or referral slip. Basically, yung hospital ID kailangan din para sa triage. Tapos kung mayroon silang previous consult, kailangan nila dala yung mga laboratories, diagnostics, tsaka yung may mga previous prescription para din ma-analyze natin yung mga previous na sakit.
How about, Doc, walk-ins? Do you cater to walk-in clients?
Yes, of course. So, we also cater to walk-in.
So kung mga walk-ins, kahit walang dala?
Basta
Or
lang
basta
pasa sila sa triage.
Yung parang may hospital card,
ID,
yung I see.
Kasi
okay.
Naka-system na kasi. So, dapat recorded.
So, speaking of acupuncture, Doc, kumusta naman po yung receipt or yung how the public or yung clients natin receive this kind of treatment? Kasi for the longest time, parang mas inclined tayo sa Western medicine or Western. Tapos, yung acupuncture is considered as an Eastern medicine. So, how is it? Kumusta naman po yung receipt ng ating client, reception ng clients natin? Marami ba yung nag-a-avail ng ating acupuncture?
Actually, maraming gusto mag-avail. Yun lang problema kasi limited lang yung practitioners.
I see.
Yung nga nag-outreach kami, maraming nakapila na outreach activities namin sa community. Maraming nakapila na mga patients. So, dyan lang na limit lang due to the number of practitioners.
And acupuncture would last how many
sessions?
No, how many minutes, hours ang isang acupuncture session?
Isang yung from acupuncture, usually 30 minutes. Pero kung nag-ano ka, moxibustion, yung sa needle tapos may heat siya, minsan umabot ng 40 minutes yung session. Wala pa yun yung interview sa history.
Pero yung how many sessions would it take for us? Depende po ba sa...
Depende sa case. Minsan 5 to 10 sessions. Depende sa case. Pag mga severe pains or mga complicated diseases, mas matagal-tagal siya.
Okay. And how much po yung babayaran?
Ngayon wala pa
price.
Yung
sinabi niyo na
kasi naayos pa yung pricing namin.
I see. Okay. So, can someone without complications avail acupuncture po?
Yes, of course. Meron kami sinasabing na wellness acupuncture.
Wellness, oo.
At saka yung may wala silang pero gusto lang nilang ma-relax. Meron ding wellness. Meron yung pero ngayon wala pa diyan yung mga sa pagpa-beauty na acupuncture. Pero hindi pa siya provide doon. Pero sa mga private practitioners, meron ganun.
Okay. Pero nasabi niyo po kanina marami yung usually nakapila under acupuncture. For example, ngayon, tomorrow I'll go to your clinic, Doc, or sa center ninyo. How soon ako pwedeng maka-avail ng acupuncture services ng center?
Diyan kasi naka-schedule. So
may schedule talaga. So, nakalista.
Pero so far ngayon, hindi pa naman ganun karami.
And
iwan ko lang after this one.
So, hindi. We will also invite our healthcare practitioners to be trained. Ano ba yung kailangan para maging healthcare provider ka ng traditional
for acupuncture, you need one basic and one advanced course training, and in order to be certified, you need at least 50 patients that you do your acupuncture. So medyo yung process. For functional medicine naman, yung training kasi is sa labas ng country natin. Pero online lang siya. There is about 6 sessions or parang lecture sessions. Tapos after that, you will take exams and you need also to be certified.
I see. Yung sa acupuncture, marami trainer po kayo, marami po tayong trainers dito sa Eastern Visayas, or do you have to go out of the region para po maging accredited or certified?
Actually, yung accredited trainer natin is sa Manila. So they have to go here, or we have to go to them or to other places na meron training in order for us to be trained. So far ngayon meron kaming this coming September meron 2 doctor na magti-train sa Iloilo for the acupuncture. Kasi kailangan na mas maraming training.
So sa ngayon, Doc, mga ilan po yung ating census sa TAC? Usually, ilan po yung ating mga clients in a day? Oo.
Siguro in a day?
In a day. Or
5, ganun lang 5 or
5.
kasi matagal.
Mga
5 per day, 5 to 10.
Okay. Sige. So, kamusta naman, Doc? Since 2021 sa establishment po ng inyong unit, ano po yung mga naging challenge natin as to the operations or siguro reception na rin? What do you think? Ano po yung ating mga
actually,
challenges?
since acupuncture is more Eastern, hindi siya Western, yung ibang doctors hindi para sila open.
I see.
Or hindi pa sila oriented. Yung sa patients naman, siguro more on kung dumami rin yung advertisement para bakit dumami. Actually, di naman lahat ng patient gusto talaga ng yung PCM kasi mayroon lang tao na gusto ng acupuncture. At least available tayo sa hospital kung mayroong gusto nilang gano'n ng services. So, in terms of supportive naman yung natin, yung administration. And indeed, nagkaroon kami ng award, Seal of Excellence Award ng TAC Wellness Center. Kasi first tayo dito sa Visayas na may TAC sa hospital. Oo. Tapos sa Visayas and Mindanao, 2 lang ata.
Wow,
Kaya
congratulations.
This coming September, I will be one of the resource person in one of the hospital congress to advocate also to other hospital for them to create a wellness center.
So ibig sabihin dito sa Visayas tayo pa lang yung may
tayo yung naka-establish at saka yung Vicente Soto nag-start pa.
Okay. Congratulations, Doc, for that award. Alright, so do we have partners po dito sa Eastern Visayas, may it be development partners, mga NGOs, or government agencies that you work with? Kasi meron din tayong DOH PTAC. So ano po yung coordination, or ano ba yung relationship with the DOH PTAC po na nasa likod lang yata ng inyong office?
Malaki yung role nila, lalo na sa establishment kasi they provided us with facility, yung mga bed, saka yung mga needles and other supplies, nung nag-start pa lang kami. And also, pag kailangan namin ng training, sila yung nagpa-facilitate, or minsan sila nga nag-sponsor ng training. Tapos, we also coordinate with some private practitioners kung kailangan. Kasi pag may mga outreach activities, kailangan mas maraming sumasama.
Okay. So, nagpo-promote din kayo ng mga herbal products, mga ganyan. Okay. Kasi yung DOH PTAC, mayroon tayo mga soap and mga medicines.
Yung sambong, tsaka lagundi, tsaka yung mga iba-ibang sabon.
Oo, yung mga sabon. So, pino-promote din
yes, meron yan dun sa wellness center namin.
Okay. Sige po. So, do you support also mga research, mga ganyan? Kasi we have just last month we had the PNHRS, so marami yung mga new discoveries. So do you actively join or support ng mga health researchers dito sa Eastern Visayas?
Yes. Indeed, last year, one of the residents did a research on the knowledge, attitude, and practices of traditional alternative healthcare sa community. And this year, meron din kaming gagawin research for the postgraduate interns. Kasi kailangan talaga more research so that ang ating practice is more evidence-based. Kasi yun ang inano naman ng Western medicine, dapat evidence-based practice. So kaya nga, dapat more research kasi medyo kulang pa sa field ng traditional na gano'n.
Alright, so another set of information and knowledge ang na-share ni Doc sa Avidra sa atin this afternoon. No? So, any message na lang, Doc, or additional information that you would like our audience, the public, to know about our traditional and alternative healthcare center sa Eastern Visayas Medical Center po?
So, right now, meron na po tayong traditional and alternative healthcare services sa Eastern Visayas Medical Center. Wherein, kung kailangan ninyo ng services other than the conventional, you need acupuncture, if you need moxibustion, if you want to learn about the use of herbs, if you want to be more holistic on the treatment of diseases, not just taking drugs, medicines. So, it's available right now at Eastern Visayas Medical Center, and we are ready. We are accepting. Just schedule lang sa
And siguro they are located at the third floor ng OPD building.
It is beside the industrial clinic.
Yung OFW and Seafarers Clinic. Yes. Okay. So, alright. So, maraming salamat once again, Dr. sa Avidra, for gracing this program na Dayon Kita ha DOH. We would also like to thank, of course, Dr. Benjamin Rodrigo Serogo ng Mental Health Center, who joined us earlier to discuss with us the Psychiatry Department ng Eastern Visayas Medical Center. So, maraming salamat sa inyo, Doc. And of course, kay Dr. Salvador Ivardone for allowing these two competent doctors to grace this show. Maraming salamat. I'm sure maraming natutunan at nalaman ng ating mga kababayan dito sa Eastern Visayas about the mental health, and of course the mental health center, and of course the traditional and alternative healthcare center ng Eastern Visayas Medical Center. So, naway nakapagbigay tayo ng kaalaman sa ating mga kababayan upang mas mapaigting pa at mahikayat na maging proactive when it comes to their health, especially sa pagsisiguro na kasama ang bawat isa sa atin, bawat Pilipino, sa pagpapalawak ng population-based services at na ipinamamahagi po ng ating gobyerno. So, again, thank you so much po sa ating mga guests and lahat po ng ating mga sumusubaybay. Another interesting topics this morning, and watch out po sa susunod na linggo. Magkita-kita pa rin po tayo muli dito sa ating programang Dayon Kita ha DOH upang sama-sama nating malaman ang mga impormasyong pangkalusugan at magtulungang maisulong ang universal healthcare dito sa rehiyon. Dahil ang inyong kalusugan ang aming priority number 1. Tara, Dayon Kita ha DOH!